back at ECCMID here at ECCMID TV at the 28th ECCMID meeting in Madrid. And I'm very pleased and happy to have a new interview guest here from beautiful country, South Africa. You are Professor Shaheen Mehtar, is that correct?
Mehtar.
Mehtar, sorry about that. You have to recognize your name, haven't you? And you're from the Stellenbosch University, Cape Town, and you chaired a very important session right now, that was the infectious control. What?
I was speaking at the A Year in Infection Control, which with Professor Hilary Humphreys, and I followed on that by chairing a session on the gaps in infection control.
So tell us a little bit about the highlights there.
The highlight, well, I work in low to middle income countries and in high income countries, and my talk was on the healthcare environment because that seems to affect both low and high income countries. So of my particular talk, I started off by what we're looking at and the sources from where we get the multi-drug resistant pathogens that then land up in wounds and cause infection. The second would be to evaluate to see how clean, because the environment is now known to play a very large role in infection control. And we need to control this, but in order to do that, we have to measure it. And therefore, we need to know that. And finally, I covered the interventions that were available in the press over the last year or so. And out of that, there were some really interesting findings, which we can discuss. And one of the most important findings from that was the fact that unlike what we've been talking about in the past, recent evidence suggests that we should remove the hand wash sinks from the clinical areas.
That's surprising, isn't it?
It is a big surprise, but it has in fact been shown and proven. First of all in the Netherlands, now in Spain for the most recent papers that have come through, and it's excellent evidence. We ourselves haven't published information, but we have shown a major reduction in neonatal sepsis and infections once a multimodal strategy, including removal of the hand wash basins from our hospital at Tygerberg. So,
why is that so? I mean, it's really surprising in the first place.
Well, the bottom line, the basic is biofilm. Right. And biofilm is a sticky substance that is produced by multiple bacteria, and it's like a coat and a cover. It's like armor, and nothing can penetrate it. So before allowing it to settle, it's always wise to remove it, and that's done by removing the dirt, cleaning properly. Once the biofilm is formed, I'm afraid it's really, really difficult to get rid of organisms, and it's very difficult, particularly multi-drug resistant organisms. So it was all about looking at the interventions that worked. Apart from the removal of the sinks, which disinfectants work? What do we do to the patients who've got infected? Well, how do we handle the environmental contamination? And some of the issues that were raised by that from many of our colleagues from across the world.
You just mentioned we have to measure it, and what tools are necessary in order to do that? It's
very strange, but in fact there's very little. The paper that I presented clearly showed that if you evaluate it with the naked eye, you are 35% out. So the best way to evaluate it, there are two other methods. One is using ATP, very expensive, can't be used in low-income countries. The other way is to apply a fluorescent dye and see if you can have removed it. So that's a periodic validations method, which is a bit more acceptable and not so expensive.
So this could help. Are there any other tools that are needed or helpful in this respect?
We always have checklists, and that also helps to know that you have covered all the areas that need to be covered, and I think that's really important. What we found in the studies that were published, which I reported, was the bed rails, the knobs which are touched, and the high-touch surfaces always seem to have a persistence.
And the handles, I guess.
The handles, yes, the high. Now, there's also another issue which I didn't address, and that was looking at heavy metals such as copper and silver and so on, and their impact on preventing the establishment of biofilm. The problem there seems to be, which is not entirely clear, it does kill the bacteria, and that is very good. But once the dead bacteria and other bacteria come on top of it, then you
get the biofilm again.
Right. So the idea is that as soon as you can, you should clean as much as you possibly can and keep the surfaces free of dirt and moisture. And one of the bugs that I was covering of pathogens is a very new organism that has been recognized. It's called Candida auris.
Yeah.
Very worrying.
I had an interview just yesterday, very interesting, from an outbreak in Oxford.
Yes,
in the ICU.
And it is worrying because they multiply in moist environments. So they multiply in the sinks, they multiply in the drains. And there again, we have to look at the possibility. And I'm sure once we remove the sinks, which we found in our health hospital anyway, it does make a big difference to the outcome of multi-drug resistant gram negatives as well as gram positives sometimes, but not as much, and also with Candida. So we don't see a lot of Candida, but I'm sure that's part of it.
And maybe more in the future.
Maybe more in the future. Yes,
then obviously there have to be measures taken in order to tackle this problem worldwide, not only in Europe, but as well in countries or where you've come from and in developing countries. What measures are most important in that respect in order to tackle it?
Well, I think the problem is that people have ignored the environment for too long. And now that they've dealt with everything else and not got rid of the problem of multi-drug resistance and antibiotic stewardship is going on, infection control, they've suddenly realized that the environment needs to be tackled. The problem seems to be that those that do the environment are not those the ones that deliver health.
Right.
Directly as clinical health. So the training programs, the education programs, the market, the tools that we need to develop, and currently we're working on some tools with the CDC, and we were talking to the WHO as well through the Infection Control Africa Network to see how we can develop some of those tools so that we've actually got methods that will work in high-income countries and middle to low-income countries as well, and anywhere that we work. A big problem we have in low-income countries is, of course, overcrowding.
Right.
And because it's so overcrowded, we can't really clean very well. So we need to look at, ideally, the whole design of healthcare facilities. How many people should you have in a room? Where should the hand wash basin be placed? Where's the ventilation coming from? And all that is part of what we have to do, and particularly somebody like me gets very involved in, to make sure that we have ways of tackling it if we haven't got the money like the high-income countries have to have direct influence on them.
But I'm sure we have to do something, because otherwise in the future, in the near future, the situation will get really, really
it can
worse.
become very untenable.
Yeah.
And I think I think it's just become recently, just in the 4 or 5 years, that there's been such an emphasis on the environment. And I think this has to be a multimodal approach. So there's got to be the hand hygiene, it has to be the alcohol-based hand rub, it's got to be cleaning the surfaces, it's got to be awareness of the healthcare worker, it's got to be awareness of the patient, it's got to be awareness of how they're going to deal with the environment, and also how they use antibiotics, how they sell antibiotics, and then we go into a whole new field, which I think was beyond our particular remit at the time. So very interesting indeed. And what was interesting with the second session, which I was chairing, was that there are gaps. The world looked at CDC guidelines as the mainstay, but now with the new WHO under Professor Allegranzi, who now runs the global IPC unit, we have started looking at evidence from other parts of the world as well. So that's really interesting. There's some dichotomy between the two, but by and large they're coming to the same conclusion. But the WHO guidelines are far more effective and applicable to low to middle income countries than indeed they would be from CDC. So it's coming to the point where everybody has recognized that there's an issue and a problem, and that we need to deal with this together.
Absolutely. And I think that a meeting like ECCMID helps you in your work, doesn't it?
Absolutely.
I mean, meeting colleagues and meeting delegates.
Well, it's really interesting. I used to be on the ECCMID board, and I haven't been to an ECCMID meeting or maybe about 15 years or so. The two things that really struck me, first of all, was how huge it is.
The size, isn't it?
The size of it. You know, but the second thing was how wonderful it was to see old colleagues and friends. And what I liked about this year was that the ECCMID group had invited back the older professors and those that had retired over years. So I met all my colleagues and friends from there. Some of my mentors, to be honest, were there. But they were mentoring the young. Right. And I think that is a great way forward, because it gives you that path of succession, it gives you the movement forward. So amazing papers came out of the Young Investigators Awards. So there's some really dynamic stuff going on through ECCMID, and I'm glad I was here today. Yeah.
Thank you very much, Professor Mehtar, for being here. Nice talking to you, and enjoy Madrid.
Thank you so much.
Hopefully see you next year.
Thank you so much.
Bye-bye.
Bye-bye.